Welcome to Vita Prime Health. I'm Dr. Eleanor Vance, a Stanford-trained physician and passionate advocate for senior wellness. For more than 20 years, I've worked with men in their 60s, 70s, and beyond who want to enjoy comfortable, connected intimacy without medications, injections, or invasive procedures. In this talk, I'm going to explore a surprisingly simple, yet often misunderstood remedy, castor oil. Along the way, we will discuss the science of circulation and nerve function, address issues like tissue stiffness and inflammation, and explain exactly how to use castor oil safely. I'll also highlight the emotional side of male vitality because healing is about more than mechanics. It's about reclaiming your sense of confidence and connection, the changing landscape of male vitality. As we get older, it is common to notice changes in intimacy. Many of my patients describe these shifts quietly, sometimes with embarrassment. A gentleman named Angus, age 68, told me, "It just doesn't work the way it used to." He was referring to blood flow, firmness, and that natural feeling of aliveness that used to be effortless. None of us notice the change overnight. It creeps in gradually as our arteries become less flexible, our blood vessels narrow, and the production of nitric oxide, a gas that relaxes blood vessels and promotes circulation, begins to decline. Studies show that nitric oxide is a key chemical messenger for penile erection, and that low levels of this molecule can lead to reduced blood flow, fatigue, high blood pressure, and even erectile dysfunction. Aging is one of the strongest risk factors for erectile dysfunction. Large epidemiological studies have found that up to 30 to 50% of men aged 40 to 70 have some degree of erectile dysfunction, and more than 60% of men over 70 experience moderate or severe problems. When blood flow to the pelvic region declines, the result is slower response time, weaker firmness, or sometimes no response at all. Another issue that can emerge is Peyronie's disease, a condition in which fibrous scar tissue, plaque, builds up inside the penis. This causes curvature, shortening, or a feeling of pulling. The Mayo Clinic explains that the only FDA-approved medication for Peyronie's disease is an injection that breaks down collagen within the scar tissue, and traction devices or surgery are used in more severe cases. Many men don't realize they have Peyronie's disease because the changes appear gradually, and society encourages silence around men's intimate health. Lastly, there is the issue of chronic low-grade inflammation. Inflammation is the body's natural response to injury or stress, but when it persists in sensitive tissues, it can interfere with blood flow, limit flexibility, and accelerate tissue breakdown. Inflammation can make things feel tighter, smaller, or simply uncomfortable. Added to this is the problem of aging skin. As we age, oil glands dry up and the skin loses fat and collagen, causing the barrier to become fragile and dry. The Cleveland Clinic notes that people over 65 are at higher risk of dry skin, and dryness can lead to cracking and micro tears. Those tears make intimacy uncomfortable and leave tissue vulnerable to irritation or infection. With this background in mind, let's explore how castor oil might help. What exactly is castor oil? Castor oil is a thick yellow oil pressed from the seeds of the Ricinus communis plant. Its primary active component is ricinoleic acid, a monounsaturated fatty acid. While castor oil has long been used as a laxative, modern medical organizations warn against ingesting it without medical supervision. The Cleveland Clinic emphasizes that most health claims for castor oil lack scientific proof and caution that applying pure castor oil to the skin can cause irritation or allergic reactions. WebMD reiterates that the only FDA-approved use of castor oil is to relieve temporary constipation. It is not a cure-all, and there are risks such as cramps, nausea, or skin reactions. Despite these caveats, castor oil does have properties that make it intriguing for topical use. Ricinoleic acid has been shown in animal models to have analgesic and anti-inflammatory effects. Researchers reporting in mediators of inflammation found that topical application of ricinoleic acid reduced swelling in several models of acute and subchronic inflammation. Repeated application inhibited inflammatory edema and reduced substance P, a neuropeptide involved in pain transmission. While these are animal studies and not direct evidence for human use, they suggest that ricinoleic acid may help calm inflamed tissues when applied externally. In addition, castor oil is rich in fatty acids and has occlusive properties that allow it to lock moisture into skin. Skincare experts note that monounsaturated fatty acids can help restore barrier function, though applying undiluted castor oil may irritate some people. Because of its thickness, castor oil tends to stay on the skin longer than lighter oils, delivering hydration over time. Those moisturizing effects might benefit delicate genital skin that becomes dry with age. However, again, there is no high-quality evidence showing castor oil specifically rejuvenates male sexual function. When I talk about castor oil, I'm not suggesting it replaces clinically proven therapies such as phosphodiesterase 5 inhibitors, e.g. sildenafil, penile injections, traction devices, or counseling. Instead, I see it as one potential element in a holistic self-care routine, a way to improve circulation, reduce local inflammation, hydrate skin, and reconnect with one's body. With that balanced view, let's explore 5 potential benefits of castor oil for men over 60, drawing from physiology, clinical experience, and the limited evidence available. 1. Stimulating blood flow. Healthy blood flow is the foundation of male intimate vitality. Nitric oxide, produced by nerve and endothelial cells, relaxes smooth muscle in the penile corpora cavernosa. When nitric oxide levels decline with age, blood vessels constrict and erectile response diminishes. Exercise. A diet rich in nitrate-containing vegetables such as beets, leafy greens, and citrus, and avoidance of smoking help maintain nitric oxide production. Castor oil may support this process indirectly. When massaged into the pelvic area, the warmth and mechanical pressure may dilate small vessels and increase local circulation. Patients often describe a pleasant warmth or tingling soon after application. This likely reflects improved microcirculation rather than a systemic effect of the oil. In practice, I recommend viewing castor oil as part of a ritual that enhances awareness and blood flow. Begin by choosing a pure, cold-pressed oil without fragrances or additives. Warm a teaspoon of oil between your palms or by placing the bottle in warm water. Gently massage the oil into the shaft, base, and pubic area using slow, circular motions. Spend 3 to 5 minutes on this step. Focus on relaxation and breath. Stress and anxiety are major contributors to erectile difficulties and can dampen nitric oxide release. After massaging, apply a warm compress, a clean towel warmed with hot water and wrung out, for 15 to 20 minutes. Heat increases tissue perfusion and may enhance the penetration of ricinoleic acid into deeper layers. Repeat this routine 3 or 4 nights per week for several weeks before evaluating results. Many men report improved morning and nocturnal erections, faster response times, and a general sense of warmth. A note on safety. If you have cardiovascular disease, diabetes, or take medications that impact blood pressure, talk with your clinician before beginning any new regimen. Avoid castor oil if you are allergic to the plant. Perform a patch test on your forearm first. If redness, itching, or swelling develops, do not use it on sensitive areas. Castor oil should never be used with latex or polyisoprene condoms because it can degrade these materials and increase the risk of breakage. Finally, castor oil is not meant to be ingested or placed inside the urethra. Keep it external and use small amounts. 2. Addressing tissue stiffness and plaque formation. One of the most unsettling changes men notice with age is curvature or shortening of the penis. This may be due to a condition called Peyronie's disease, characterized by the formation of fibrous plaques in the tunica albuginea, the sheath, covering the erectile tissue. The plaque does not stretch like normal tissue, causing the erection to bend or feel tight. The Mayo Clinic notes that the only FDA-approved medication for Peyronie's disease is a collagenase injection that breaks down the built-up collagen. Traction devices and surgical corrections are used for significant deformities. Oral medications and supplements have not shown consistent benefit. Given this, castor oil cannot cure Peyronie's disease, but it may help with minor tissue stiffness caused by subclinical microscarring or collagen deposition. Ricinoleic acid's anti-inflammatory properties could, in theory, reduce fibroblast activity and soften collagenous tissue over time. In the animal studies referenced earlier, repeated topical application of ricinoleic acid reduced edema and suppressed the neuropeptide substance P, which might translate into less tissue irritation. In my practice, I've seen some men with mild curving or a sensation of tightness notice gradual improvement after several weeks of regular castor oil massage combined with gentle stretching. Here's how I coach them. Massage and warm the oil as described above. After application, perform gentle stretches of the penile tissue. Gently pull the shaft straight out or in the direction opposite the curve for a few seconds. Release and repeat. Do not use force or cause pain. The goal is to encourage elasticity. Consider using a traction device if curvature is moderate to severe. Evidence shows that traction therapy can reduce curvature and prevent length loss in Peyronie's disease. Talk with a urologist before using one, as proper sizing and technique are essential. Persistence and patience are key. Tissue remodeling occurs slowly. Expect several weeks to months before noting changes. If you suspect Peyronie's disease, consult a healthcare professional promptly. They may recommend imaging, injections, or other therapies. Castor oil should be viewed as a complementary practice, not a primary treatment. 3. Calming chronic inflammation. A surprising number of older men experience low-grade inflammation in the pelvic area without realizing it. They describe it as a burning sensation, tightness, or a feeling that everything is shrinking. Chronic inflammation may result from recurrent infections, unaddressed skin conditions, friction from clothing, or metabolic disorders. It can impair blood flow, accelerate collagen deposition, and dampen nerve signaling. Reducing systemic inflammation through diet, as in a plant-rich diet high in antioxidants, exercise and adequate sleep is crucial. Topically, castor oil might offer relief. The anti-inflammatory effects of ricinoleic acid described earlier are particularly relevant here. In the animal models, repeated application of ricinoleic acid markedly inhibited inflammatory swelling. Although human data are lacking, many patients anecdotally report decreased burning or tightness after using castor oil regularly. The oil's viscous nature forms a protective layer that shields delicate skin from friction, while the warmth of massage increases circulation and encourages lymphatic drainage. If you are dealing with chronic inflammation, identify and address triggers. Inflammation often stems from underlying infections, such as yeast or bacterial balanitis, dermatitis, or poorly controlled diabetes. Work with a healthcare professional to diagnose and treat the root cause. Use castor oil judiciously. Apply small amounts 3 to 4 times per week. If burning or itching occurs, discontinue immediately and consult a dermatologist. Incorporate systemic anti-inflammatory practices. Eat a diet rich in fruits, vegetables, whole grains, and omega-3 fatty acids. Minimize processed foods and sugar. The University Hospital's blog notes that foods like beets, leafy greens, garlic, and citrus help support nitric oxide production and thus improve vascular health. Exercise regularly. Physical activity boosts nitric oxide and reduces systemic inflammation. Even brisk walking, tai chi, or swimming for 30 minutes most days can improve circulation and mood. Remember that castor oil is not a substitute for medical evaluation. Persistent inflammation may signal conditions requiring targeted treatment, such as lichen sclerosis, psoriasis, or infections. Always consult a clinician when discomfort persists. Fourth, supporting nerve health and sensation. One of the complaints I hear most frequently from older men is a loss of sensation. A patient named Larry, age 70, told me with tears in his eyes, "I can still perform, but I don't feel it the way I used to. It's like my body is going through the motions." Teat. Nerves are incredibly delicate. Diabetes, high blood pressure, chemotherapy, pelvic surgeries, and chronic inflammation can all impair small nerve fibers. Reduced blood flow further compromises nerve health. When nerve endings become less responsive, men describe numbness, a rubber glove feeling, or an emotional disconnect during intimacy. There is no direct evidence that castor oil regenerates nerves. However, by improving local circulation and reducing inflammation, we can create an environment conducive to nerve recovery. Ricinoleic acid's anti-inflammatory activity may help calm irritated nerve endings, while the warm massage increases oxygen delivery. Additionally, the ritual of touch itself fosters mind-body connection. When men take time to gently massage their pelvic area, they often become more attuned to subtle sensations that they had overlooked. This mindfulness can reignite pleasure. If nerve sensation is a concern, optimize metabolic health. Maintain blood sugar, blood pressure, and cholesterol within recommended ranges. Diabetes is a major cause of peripheral neuropathy and erectile dysfunction, so work closely with your doctor to manage it. Use castor oil as part of a sensory practice. When applying the oil, focus on the sensations under your fingers. Note warmth, tingling, and any changes in sensitivity. Over time, this attentiveness may enhance neural pathways. Consider pelvic floor physical therapy. Specialized physiotherapists can teach exercises that improve nerve signaling, muscle tone, and coordination in the pelvic region. Explore therapies for neuropathic pain if present. Medications such as gabapentin or topical lidocaine can help, though they require a prescription. Again, castor oil is not a cure but a supportive adjunct. If sensation loss is sudden or severe, seek medical evaluation to rule out nerve compression, diabetes, or cardiovascular issues. 5. Nourishing and protecting aging skin. The skin of the genital region is thin and sensitive. With age, vital hormone levels decline and oil-producing glands become less active, causing the skin to lose elasticity and moisture. The Cleveland Clinic notes that people over 65 are more likely to experience dry skin. Dryness can cause cracking or bleeding. Tiny micro-tears not only hurt, but create entry points for bacteria, fungi, and irritants, leading to dermatitis or infections. Moisturization is therefore essential. Castor oil's viscosity enables it to form a protective barrier that locks moisture into the skin. Because it's rich in ricinoleic acid and other fatty acids, it may help restore the lipid matrix that holds skin cells together. However, pure castor oil can cause allergic dermatitis or clog pores. To minimize risk, choose the right formulation. Use 100% pure cold-pressed castor oil. Avoid industrial or refined oils and those with added fragrances or preservatives. Dilute if needed. Some people mix castor oil with a lighter carrier oil like sweet almond oil or jojoba oil at a ratio of 1:1 to reduce thickness and potential irritation. Perform a patch test on less sensitive skin, as in inner arm, before applying to the genitals. Wait 24 hours. If there is no redness or itching, proceed. Apply sparingly. A drop or two is enough. Gently massage it into the skin before bed and allow it to absorb. Hydrate internally and externally. Drinking enough water, using a humidifier, and protecting skin from harsh soaps and hot water will all help. Discontinue if irritation occurs. Signs of contact dermatitis include redness, itchiness, and rash. If you experience these symptoms, stop using castor oil and consult a dermatologist. Healthy skin supports healthy nerves and blood vessels. When the barrier is intact, tissues underneath are protected from friction and environmental stress. With regular moisturization, you might find yourself more comfortable and less apprehensive during intimate moments. How to use castor oil safely and effectively. Healing doesn't happen through guessing. The way you apply castor oil matters. When my patient Albert, age 68, first heard about this method, he said, "You want me to put what where?" But after I explained the process, he agreed to try. A few weeks later, he admitted he looked forward to the ritual because it helped him reconnect with his body. Here's the step-by-step guide I share with patients. Gather your supplies. 100% pure cold-pressed castor oil, a small bowl of warm water or a heating pad, a clean towel, optional lighter carrier oil for dilution. Check for allergies. Perform a patch test on your forearm or behind your knee. Wait 24 hours. If there is no reaction, then continue. Warm the oil. Place the bottle in warm, not boiling water for a few minutes, or rub the oil between your hands. Warm oil penetrates skin more readily and feels more soothing. Massage gently. Apply a small amount to the shaft, base, and surrounding pubic area. Use slow, circular motions with light pressure for 3 to 5 minutes. Focus on relaxation rather than goal-oriented fixing. Add gentle heat. Apply a warm, damp towel over the area for 15 to 20 minutes. Heat increases circulation and helps the oil absorb. Alternatively, use a heating pad set on low. Do not fall asleep with a heating pad. Repeat regularly. Aim for 3 to 4 nights per week. Consistency is more important than quantity. Continue for at least 4 weeks before assessing effects. Monitor your body. Keep a journal of changes in blood flow, sensation, comfort, and emotional response. If you notice irritation, stop using the oil and consult a healthcare provider. If you see significant curvature, pain, or erectile difficulties, seek evaluation. When to seek professional help. Castor oil is not a replacement for medical care. Consult a urologist or primary care physician if you have persistent erectile dysfunction, pain, curvature, swelling, or changes in the appearance of your genitals. Conditions like Peyronie's disease, infections, prostate disorders, and hormonal imbalances require targeted diagnosis and treatment. Medications such as PDE5 inhibitors, injections, vacuum erection devices, and surgery have strong evidence for efficacy. Castor oil can be part of a self-care regimen, but it should not delay appropriate medical evaluation. The emotional dimension, reclaiming connection and confidence. I have worked with men long enough to know that intimate health is deeply tied to identity and self-worth. When things change, men often withdraw emotionally. They might avoid physical closeness for fear of embarrassment or failure. Partners may misinterpret this withdrawal as lack of desire, creating distance in relationships. I firmly believe that open conversation, compassion, and self-care can transform this experience. Performing a castor oil ritual can be a mindful practice. It offers an opportunity to slow down, to explore one's body without judgment, and to reconnect with sensations. Several of my patients have told me that the practice itself, regardless of physical outcomes, made them feel more connected to their bodies and more confident. One man even said he began sharing the ritual with his spouse, turning it into a moment of shared intimacy and healing. Remember that you are not alone. An estimated 1/3 of men over 60 experience erectile difficulties. Many others deal with dryness, curvature, or loss of sensation. Talking about these issues with your healthcare provider, partner, or supportive community reduces shame. It also empowers you to seek evidence-based solutions. There is no need to suffer in silence. Integrating castor oil into a holistic wellness plan. To reap the greatest benefits, combine castor oil use with broader lifestyle strategies. Prioritize cardiovascular health. Maintain healthy blood pressure, cholesterol, and blood sugar. Eat a balanced diet rich in whole foods and nitrates, like leafy greens and beets, to support nitric oxide production. Exercise regularly. Aim for at least 150 minutes of moderate aerobic activity weekly. Exercise boosts nitric oxide, improves endothelial function, and enhances mood. Manage stress. Chronic stress activates the sympathetic nervous system and constricts blood vessels, hampering erections. Incorporate mindfulness, meditation, yoga, or deep breathing exercises. Get adequate sleep. Sleep deprivation reduces testosterone and nitric oxide production, both essential for sexual health. Stay hydrated and moisturize. Drink plenty of water and use appropriate skincare products. The Cleveland Clinic warns that dry skin is common in older adults and can crack and bleed. Protecting your skin will support comfort and confidence. Avoid smoking and excess alcohol. These substances impair blood vessels and nerve function. Engage in open communication. Talk with your partner about your experiences and explore new ways of connecting physically and emotionally. Seek professional guidance. Regular health checkups ensure that underlying conditions such as diabetes, high blood pressure, hormonal imbalances, or prostate disorders are addressed. Final thoughts. Castor oil is not a miracle cure. As major health organizations point out, evidence for many claimed uses of castor oil is weak or non-existent. However, the oil's anti-inflammatory, analgesic, and moisturizing properties, supported by animal studies and general dermatological knowledge, suggest that it may play a supportive role in male pelvic health. When combined with gentle massage and warmth, it can help stimulate blood flow, soften minor tissue stiffness, reduce discomfort, protect aging skin, and perhaps most importantly, encourage a mindful connection to your body. If you decide to experiment with castor oil, approach it with curiosity and care. Use pure, high-quality oil. Test for allergies. Apply gently and consistently, and pay attention to how your body responds. Incorporate it into a broader wellness plan that includes diet, exercise, stress management, and open communication. And always remember, if something feels wrong, seek professional advice. Your health and well-being are worth it. Thank you for spending time with me here at Vita Prime Health. If this talk resonated with you, subscribe to our channel and hit the bell icon so you won't miss any important updates, like the video, and share it with someone who might benefit. Your support allows us to continue providing honest, research-backed information for seniors. Until next time, take care of yourself and keep cultivating vitality.